What are the indications for spirometry? As Dr. Thomas Petty was fond of saying, physicians don't prescribe blood pressure medications without taking blood pressure or heart medications without doing EKGs. Why do they prescribe medicines used to treat breathing problems without doing spirometry? The most common indications in a primary care setting for spirometry are to be able to diagnose lung diseases, categorize the severity of the disease, measure the effectiveness of therapy, and evaluate the preoperative risk. There are very limited things that you can diagnose with spirometry. You can define obstructive lung disease, and some of the examples are asthma and COPD. COPD can be further broken down into bronchitis and emphysema. These diseases are commonly found with narrowing of the airways. In some cases, such as asthma, it is caused when the muscles around the small airways constrict, or in other cases where there's inflammation of the airways. It could also be reduced because of an inflammation process such as bronchitis. Finally, emphysema is a disease where the air sacs or alveoli get stretched out because air gets trapped in the lungs. The alveoli then rupture and reduce the amount of surface area available for gas exchange in the lungs. This also causes collapsing of the airways against each other, further restricting the ease with which people can exhale. Restrictive lung diseases reduce the how much portion of the measurement. That is, the chest cannot move as much as it should be able to move. Obesity is one of the common problems. In people with morbid obesity, the chest wall is held down by the additional weight on the chest. There are others that are deformations of the chest, such as kyphoscoliosis. There are problems also caused with the muscles and the nerves that control the muscles as they move the ribs up and down in order to breathe. Finally, a restriction can be caused by an inflammation or a swelling of the actual lung tissue itself, or from the blood vessels that are located within the lungs. The last process is commonly found in pulmonary fibrosis and pneumonitis, among other conditions. These diseases are much less common as a category than asthma and COPD. The gold standard indicates that spirometry should be used in the diagnosis and assessment of COPD and should be performed on everybody that's suspected of having COPD. The National Asthma Education and Prevention Program, in their expert panel review 3rd edition in 2007, also said that spirometry is a vital part of monitoring and diagnosing people with asthma. The second indication is to categorize the severity of the disease. The other indications for spirometry in an office setting are categorizing the severity of a disease, measuring the effectiveness of therapy, and evaluating the preoperative risk. Spirometry should be used in all patients over the age of 45 that are smokers, to identify people at risk from occupational exposure to various chemicals and fumes, and for those people that have symptoms that are commonly found in obstructive lung disease.